So when I was a freshman in college, I decided that I wanted to be a lawyer. And to test this hypothesis, I started interning in the housing unit at Greater Boston Legal Services. So I remember showing up my first day on the job, totally prepared to make, coffee and photocopies because, let's be honest, that's all I was trained to do at that point in time. And instead was thrust onto the front lines from the very first day. And over the course of my 9 months at Legal Services, I had the chance to have conversations with dozens and dozens of low-income families in Boston and really sort of talk with them about the challenges that they were grappling with. And what I found in these conversations was that although families would present with housing issues, because we were a housing unit, whenever you scratched the surface, there was always an underlying health issue. So I remember one of my clients was about to be evicted. He hadn't paid his rent. And I said to him, if you don't pay your rent, you're probably going to be evicted. And he said, I'm paying for my HIV medication instead. And it seemed like the right choice to me. One of my clients was a mom whose daughter had asthma, and every morning she would wake up covered in cockroaches. One of our key litigation strategies was to go to their homes and actually collect the cockroaches in bottles and hot glue gun them to a piece of foam core and bring it to court. And we always won, mostly because the judge was just totally grossed out. It was extremely effective. But over the course of my 9 months there, I became, just fixated on this connection between health and poverty, and at the same time, really frustrated with intervening so far downstream. By the time families came to us, they were in crisis, and it seemed too late. So at the end of my freshman year of college, I read an article in the Boston Globe magazine about Barry Zuckerman, who was then and still is chair of pediatrics at Boston Medical Center. And Barry had this kind of radical but totally obvious vision that a pediatrics department should be a place where kids get healthy. And to realize that vision, he had brought together a dream team of professionals, lawyers, social workers, developmental psychologists, to just tackle all of the barriers that families face to being healthy. And I just thought this was brilliant. So at the start of my sophomore year of college, this was in the pre-internet era, called information, got his phone number, and cold called him, and in some miracle, got put through to him right away. And I remember stumbling through this conversation with him, notably congratulating him on his good work. I remember, I can imagine him being like, you're 18, why would I care? But telling him that I thought there could be an important role for young people in what he was doing. And to Barry's great credit, he only half blew me off and basically said, why don't you go spend 6 months actually talking to some doctors and patients, and then we'll talk. So I just thought this was awesome. I mean, I had just been authorized to wander around this hospital and attach myself, frankly, to anyone who would listen to me, which is exactly what I did. And I ended up having just an incredible and, for me, life-changing set of conversations with pediatricians in a big urban hospital. And, with no health background, I would just say to them, if you had unlimited resources, what is the one thing you would give your patients? And they would just say in almost kind of confessional tones, here's the thing, Rebecca. Every day, we have patients that come into our clinic, and the child has an ear infection or an asthma exacerbation, and I provide antibiotics or I provide an inhaler, but the real issue is there is no food at home. The real issue is this family is living in a car, and I don't even ask about those issues because I have no idea where to begin. I wasn't trained to deal with these issues. I don't have the time to deal with these issues. I know that these factors will have a more profound impact on my patients than anything I'm going to do in the next 13 minutes in the 4 walls of this doctor's office, but I don't even ask because I don't know where to begin. And I remember thinking, I don't know anything about the healthcare system, but this isn't a system. I mean, this is just total chaos. And so our Family Help Desk program was born of those conversations. So the Family Help Desk is a physical desk located in the waiting room of the clinic, and when a patient comes into the doctor's office and the physician or nurse identifies any unmet resource needs, like food, housing, heating assistance, exercise programs that would impact the health of the patient, the doctor has a prescription pad and can literally prescribe food or prescribe housing for a family. The family takes the prescription to the family help desk, the same way they take a regular prescription to the pharmacy. And then our core of college volunteers will then, both on-site in the clinic and through ongoing follow-up, connect that family to whatever set of resources that it needs to be healthy. And so, this immediately took off. And today, Project Health has 600 college students in 6 cities that are connecting over 12,000 children and adults every year with the resources that they need to be healthy. Thank you. Our aspiration, though, is not just to serve more children and families, although we will certainly do that. Our aspiration is to change the way that healthcare is delivered in this country. Right now, the healthcare debate focuses on access to care and quality of care, which are absolutely critical. But we will not move the needle in actually improving health outcomes or actually reducing healthcare costs until we get serious about the social determinants of health. It is well documented in the medical literature that access to basic resources like food or housing directly impacts health outcomes and healthcare utilization. So, for example, a family with a young child that's eligible for help with heating and electricity that doesn't receive that help, the child's 30% more likely to be hospitalized by age 3. And the same is true for food. And yet, at the same time, and this is, of course, the challenge, the healthcare system is in no way designed to be able to address these needs. And so we, for example, we are in a clinic on the south side of Chicago where there are 60,000 patient visits a year, an 87% Medicaid patient population, and 1 full-time social worker on staff. At Bellevue Hospital in New York, there is 1 social worker for every 12,000 patients. At Boston Medical Center, there are 22,000 pediatric emergency room visits a year and 1 social worker who is there 9 to 5. So this is the question: how do we possibly begin to cure this massive infrastructure deficit in this country? And so we envision a healthcare system in which all clinics that are serving substantial low-income patient populations are screening all of those patients for unmet resource needs and connecting patients with those needs to the resources that they need to be healthy. And this, of course, ultimately is our vision. At this moment in time in our country, everybody thinks that healthcare is a disaster, right? It's expensive, it's bureaucratic. Yesterday, somebody called it intractable. And we at Project Health believe that things can be different. By deploying our volunteers out to clinics across the country, we are not only increasing the capacity of those clinics to address the real needs that their patients face, but also creating a next generation of leadership that has the tenacity and conviction to create real change in the healthcare system. Project Health's model is simple, it is effective, and it is cheap. And in doing so, by putting a bunch of college kids, in a clinic waiting room, we empower physicians to address the real issues that their patients face, and in doing so, begin to change the healthcare system itself. Thank you.